One innovation that to me is really interesting for patients with cerebral palsy is actually not so fancy or so new, but it's a concept of guided growth, and we're using it in new ways. So guided growth is just a general term for guiding the growth at our growth plates in order to grow one way over the other. So for instance, we can put a screw or a little plate on one side of a growth plate, which is the area that growing children grow from at the ends of each of the bones. If we put it on one side, we encourage one side to grow more than the other side. And so with that, when kids are still growing, you have the chance to correct some kind of malalignment, and it could be in different planes, like we call it in the frontal plane, looking at a child, or on the side, looking at a child. So anyway, in cerebral palsy, there's two areas that we like to use that for. One of them is especially new, where we are using it to try to guide the growth of the hip more into the socket. So children who don't walk on time by around 18 months can have the anatomy of the hip not necessarily be normal because they don't put weight through the ball and socket joint, and then the ball can kind of gradually drift out. And so with that, then you might later on have to do surgery to get the ball to go back in. And so guided growth, we are realizing at an earlier age, might help us to encourage the growth into the socket instead of having to do big surgery later on, or at least to delay the bigger surgery later on. So we're using pretty common, simple, older techniques and new ways to prevent problems or make bigger problems for our patients smaller problems.